Hi, I'm Justin Riley. Today on Wisconsin Doctors, diabetes and wound care. How the two are related, and more importantly, how they can both be managed. We're here on location at the Fort Healthcare Wound and Edema Clinic to find out more. And I'll be joined by Mary Carvalho, who is a registered nurse and the clinic coordinator for the Wound and Edema Clinic. I'll also be joined by Dr. Robert Goldman, who is the medical director at the Wound and Edema Clinic, and Rhonda Pertlewitz, registered nurse and diabetes education coordinator for all of Fort Healthcare. It's going to be a great show. It's all coming up right here on Wisconsin Doctors. Stick around. Hey folks, welcome back to Wisconsin Doctors. We're here on location at the Fort Healthcare Wound and Edema Center right here in Johnson Creek. And we are so excited to be here because we're going to learn a little bit more about what they do here. And I'm joined first by registered nurse and clinic coordinator Mary Carvalho. Thanks for having us here today, Mary.
Oh, it's good that you're here.
Yeah, we're so glad to be here. Tell us a little bit about the Wound and Edema Clinic.
The Wound and Edema Clinic is focused on healing chronic wounds. Chronic wounds are those wounds that have been around at least 30 days or longer. Sometimes we see people who have had wounds for years, 12 years, 15 years.
Wow.
It's pretty amazing when we tackle this. We use a lot of resources. The other thing that we focus on is edema. And edema is basically swelling. We usually see it in a limb, and oftentimes the two things are interconnected. If you have a wound in your foot and you also have the swelling, which is very frequent, your foot wound won't heal until we've dealt with the swelling in your leg. So we use both methods to help you heal, and we do it pretty efficiently. We also have hyperbarics that we can use for people who meet certain criteria, and that also helps them to heal.
And the hyperbarics we're going to hear a little bit about later on in the program, and then we'll hear at more length later on in our season, as I understand. So we're excited to learn more about that. 12 years. That's incredible.
It is. Wounds that are chronic tend to crust over, and we see this especially on ankles and feet, and it's just, if you looked at it, you wouldn't even realize that it's actually a wound because it's no longer draining. The problem is it is a wound, and you're prone to a lot of infection with it.
Yeah. And
it is pretty nasty. It takes our whole team to get someone with a chronic wound like that to heal.
Wow, that's amazing.
Hi, Mary. For the viewers, will you tell them how to refer people here?
The interesting thing is most of the time when you need to see a specialist, your physician needs, or physician's assistant, whoever, needs to call in a referral. For this clinic, you can do it yourself. If you have a wound and you've been seeing your physician for a long time and it's not healing, you give us a call. And we can, insurance accepts this. So whether it's the edema or a wound, you can call us and make an appointment.
Wow, patients referring themselves. That is really cool.
It is. They're very skeptical when they call, and they're like, is this true?
Right.
And we have to talk them through it. Yes, your insurance will cover this and everything. Wow. It is very interesting.
That's really comforting to know that patients can get a more speedy recovery and they don't have to wait for the referral process to go through. What a relief.
It is. And many physicians don't know to call us.
Right.
It's still a specialty that is now gaining more prominence, but it is new. Most physicians have not trained in chronic wound care.
Absolutely, yeah.
So Mary, of all the foot and leg wounds that you see, which do you think are the hardest to heal?
The diabetic foot wound is definitely one of the harder ones to heal, just because there's so many factors. You have the whole control of the diabetes, and then if the person is insensate or has no feeling in their feet at all, we oftentimes have deformity of bones, balance issues, and it is extremely hard to heal.
So patients will experience not being able to feel anything, and that's often why those wounds go unnoticed, as I'm understanding.
Right. It is. I mean, we've pulled my favorite, well, not really, but a Barbie shoe out of the bottom of somebody's foot. The patient had no feeling, had no idea it was there.
Do we have a picture of that? Anybody? No. Okay. Just thought I'd check.
You know,
we have other
we have other pictures
we can
show you. But really, if they have no feeling in either of their feet, it leads to falls.
Right.
But it is one of the things that Rhonda helps teach them is to check their feet all the time.
Right.
And that's really important, because otherwise the thing that they notice is after a shower, wherever they walk, they're leaving trails of blood, and then they go, oh, there must be something down there.
Oh, goodness.
And it's hard to see the bottom of your feet.
Right, absolutely. But this is part of the diabetes self-awareness education that Rhonda's going to talk about later on in the program. So we'll look forward to hearing that. So, other than the fact that, the patients have a hard time feeling this and maybe they don't notice it, why are these so hard to heal?
Usually the diabetic has a measure of atherosclerosis, or hardening of the arteries that are leading the blood flow down to their feet. So if you're not getting good blood flow, all of those tissues in your feet, especially near the soles of your feet, actually are starving for oxygen and the nutrients that they need to heal.
Right.
So that's one of the issues. Somehow we have to improve the blood flow down to their feet.
Yeah, and you guys have a number of ways to do that, which we're going to find out over the course of today and several other episodes. And speaking of which, what can we expect from the Wound Clinic here in future episodes? What can we look forward to seing here?
We will definitely introduce you to hyperbarics so that you can actually see the hyperbarics and talk to the technician who does all of we call them dives or the treatments. We will also talk a little bit more about venous leg disease. We'll really go into depth on diabetic foot ulcers in a future ones. And we have a few other topics that we're still working on exploring.
Very cool. Well, Mary Carvalho, the clinic coordinator and registered nurse here at the Fort Healthcare Wound and Edema Clinic, thank you so much for the information today.
Oh, you're welcome.
Don't go away. When we come back, we'll be talking with Dr. Robert Goldman, the medical director here at the Wound and Edema Center. Don't go away. And welcome back to Wisconsin Doctors. We're so excited to be here at the Fort Healthcare Wound and Edema Clinic in Johnson Creek. And it's been great because we're learning a lot about different types of wounds and how they're healed and different practices like that. And now we're going to be talking with Dr. Robert Goldman, who is the medical director here at the Wound and Edema Clinic. Welcome, and thank you for having us.
Thanks. It's a real pleasure to be here.
Yeah, absolutely. So we're going to talk a little bit about diabetes and limb preservation. So first I want to ask, how does having complications of diabetes lead to the risk of wounds, obviously, and then limb loss?
Well, Mary did speak to this before. The big thing that we talked about was neuropathy, or problem with nerves. And that is absolutely huge. People will have a tack in their shoe and not know it, and they'll pull out and they'll have a wound. What happens is that the nerves they're toxified, if that's the right word, by the blood sugar increase, especially nerves that are long that go from the spine down to the foot. And what that does is it leads to the nerves dying, and then the muscles that the nerves go to also die. So you have more bones in the foot sticking out and increasing pressure, and can lead to ulceration. When an ulcer does occur, people with diabetes have more difficulty healing it for two reasons. One is the white blood cells and the immune system don't work as well, so that they tend to get more and deeper infections, harder to heal. And then the last one is they tend to get, as Mary said, calcified arteries. These arteries tend to be more lower down in the leg, which are harder to get to. And the combination of things, you have less oxygen, you have less active white blood cells, and you have more problems with pressure. And so these wounds tend to get really bad relatively quickly, and they demand a lot of challenge in order to heal them.
Now, you talked a little bit about nerves dying. Is that something, I mean, is that permanent? Like if the nerves die, can they ever come back?
Not for this. Usually for this, they do not come back.
Wow. Okay.
No.
Wow.
So, Dr. G, can you explain to the viewers what kind of, that if they have limb loss, what it means to society in general?
Right, so the idea is that, how big a problem is this? It's actually a huge problem in that, especially for people with diabetes, in that diabetics are 50 times more likely to get a lower extremity amputation than are people without diabetes. And by amputation, I mean an amputation below the knee, maybe a few inches below the knee. And when this happens, patients with a limb loss are more likely to be not around, pass away at 5 years than be here. In other words, it's a 50% 5-year mortality, which is higher than a lot of cancers. Now, it's also because of all the other disease burden that they have along with the diabetes, but still, these are very troubling numbers. So we want to try and preserve limbs, not to mention improve quality of life and the fact that everyone wants 2 legs.
And I want to make sure that viewers understand that you said that they, if they have diabetes, it's not that they're 50% more likely to lose in a lower extremity, they're 50 times more likely to lose a lower extremity.
They're 50 times more likely to lose a
Wow.
limb. That's 50 times.
Like 5,000%.
That's right, as Mary was saying, like, there's a lot of different things lead into this.
Wow, wow.
So, Dr. Goldman, can you tell us what kind of progress has been made in taking care of the diabetic leg and foot wounds?
Sure, well, it turns out that in the past 12 years, the number of leg amputations has gone down by 60%. And that's a really encouraging number. And
Yes.
it has to do with, as people suspect, better management of diabetes, better control of blood sugar, more people getting primary care, better management in terms of medications, better understanding of diet. And I would add to that is something that we've been just talking about, is foot management. People having the right kind of shoes, the right kind of padding, the right amount of room in the toe, changing them every 6 months, having somebody inspect them, dealing with calluses, and overall just keeping that happen can prevent ulcers. So there is an improvement.
Wow. And as I understand it, the wound clinic here has some things that they can do if someone is heading in that direction of maybe the possibility of losing a limb might be growing for them. You guys have some ways of maybe reversing that a little bit or helping to prevent that. What can you do?
Right, so what we can do here is we can bring to bear a plan to help that patient. Okay, so we have various different specialties, and we form a team. And we're all under one roof, and we talk to each other under one roof, so that the different parts of the team are the wound care doctor, who's like the leader of the orchestra, the conductor, dealing with all the other elements of the team. There is the nursing, which deal with all the nursing supplies and control of teaching the diabetic patient what to do. That's absolutely critical because patients are not going to do it if they don't understand it.
Right.
There's also a weight relief plan, we'll call it a rehab plan, where people have to off-weight one way or another. And that's very important for healing diabetic foot ulcers. And that's another part of the team. Another one is a surgeon. It could be a podiatric surgeon, an orthopedic surgeon, or some other surgeon, because a lot of these folks have deep infections that need to have some cleaning of that area, maybe even involving some bone loss, perhaps, I'm sorry to say.
Right.
When that happens, you can actually take off a toe if you have to in order to save a limb.
Yeah.
And then you still can walk.
Right.
So then there's another one is that if you get a deep infection, there is a special antibiotic doctor, infectious disease doctor, because they need antibiotics for 6 weeks. And that's a medical issue for the specialist. And lastly, there's the vascular doctor. So we talked about hardening of the arteries. So you can do a procedure like people get on their heart, which is like a cardiac catheterization. People are familiar with this, where they actually put little tubes down there and they have balloons.
Sure.
And they can get rid of blockages in the heart. Well, they can do the same thing in the legs. And you can go all the way down to the feet to do this. And this is probably one of the biggest advances in the past 10 years, is improving minimally invasive revascularization, which we use a lot, and it really does improve things. Also in our clinic, we have hyperbaric oxygen. So you have a very rich oxygen material that goes to the wound. It uses the white blood cells, it makes them more effective, it tends to kill bacteria and get more oxygen in the wound to help it heal. So that actually also promotes limb preservation. We have a whole criteria for this. We're pretty effective at that, and we have some really good results. And so you put that all together, and we have a way to really make this happen. It takes more than, it takes a village. And that's us.
Yes, you're the village. Well, Dr. Robert Goldman, Medical Director of the Wound and Edema Center here at Fort Healthcare, thanks so much for joining us.
You're welcome. Thank you very much.
Don't go away. When we come back, we'll learn a little bit more about diabetes management and education. Stay with us. And welcome back to Wisconsin Doctors. We're very excited to be here on location at the Wound and Edema Center, part of Fort Healthcare, right here in Johnson Creek. And I'm excited to be talking with Rhonda Pertlewitz, who is the Diabetes Awareness Coordinator for all of Fort Healthcare. Rhonda, thank you for having us here today.
Thank you for coming.
Yes, it's our pleasure. So talk to us a little bit about diabetes self-management education. That's a big part of what you do.
It is. Diabetes self-management education is a multidisciplinary, ongoing process in which the person with diabetes and their family gains the knowledge and the skills they need to manage their diabetes successfully.
Very cool. Very simply put, but there's a lot that goes into that, but it's very core. It's kind of a very simple idea.
And it's all about the multidisciplinary. It's about the team, the diabetic care team. The first member of that team is the patient, the person with diabetes. Next is their primary care physician. They need the referral from the physician monitors their medications, keeps track of their A1C and their important diabetes labs. Then you have the diabetic nurse educator, that's me, and I'm going to help you understand what's happening in your body. How can you help your body help itself? How can you manage your blood sugars better? And then of course the dietitian, because the first question anyone with diabetes says to me is, what can I eat?
What can I eat? What can't I eat?
What can I eat?
Yeah.
What can't I eat?
Absolutely.
Exactly. So the dietitian is the last person. You could also have the endocrinologist too. Again, it takes a village. We all work together.
Yes, absolutely.
Rhonda, who would be best to receive diabetic self-education?
Diabetes information is always changing. Diabetes itself is always changing. It is a progressive disease. It does get worse over time. The key times a person should have diabetes education is, number one, when they're first diagnosed. You need to know, how important is this? What should I do? How should I do it? Then once a year after diagnosis, let's touch base. Let's make sure nothing's changed. Let's make sure your current diabetes regimen is still working. And then anytime a person has a transition in care or a change in their health condition, all of those times are warranted a visit to your diabetic nurse educator.
And diabetes is not something that can be cured, but it can be managed, it sounds like.
Right.
Yeah.
Once you have diabetes, you always have diabetes, but you can have diabetes in good control, and you can have good blood sugar management. And that is our goal with diabetes self-management education, is to help you learn how to manage your blood sugars.
Absolutely.
Is there anything that I should be looking for if I'm a diabetic and I'm looking for a program?
If you're looking for a diabetes self-management program, and this is for anywhere across the United States, you want to look for a program that's been recognized by the American Diabetes Association. When you find a recognized diabetes self-management education program, what that means is that program is they're following the national standards for diabetes self-care and support. Fort Healthcare has been a recognized program since 2005.
Wow, okay. So we've been talking a lot about, you know, the wounds that result from diabetes and so forth, and you're kind of talking about catching it early, it sounds like, and trying to get at it before they become, you know, serious issues with, you know, having to potentially have amputations and so forth. But let's go back even further. Let's talk a little bit about what are the symptoms of diabetes. If I've never been checked for diabetes before, what should I be looking for? What are some of the early warning signs?
That is an awesome question, because our body compensates for a high blood sugar for a very, very long time. You don't feel high blood sugars. High blood sugar symptoms. Number one symptom is fatigue, being tired. Okay, who here isn't tired? Seriously, we're all tired all the time. Second symptom, increased thirst. Well, I'm thirsty, but it's winter in Wisconsin.
Sure,
the furnace is on and the air is dry, right? And if I'm drinking more often, of course I'm going to go to the bathroom more often, right? Frequent urination. Again, it's something that you don't think about. How many times do you get up in the middle of the night to go to the bathroom? Can you sleep through the night? That's the question. Dry, itchy skin. Poor wound healing. What if I don't have a wound? How do I know how it's healing? Blurred vision, increased hunger, and or unexplained weight loss. I'm sorry, but if I'm losing weight and I'm not trying, I'm going to just do a happy dance.
Oh, sure.
I'm not going to think, oh no, I have diabetes.
But that can be a sign of, I mean, you know, weight loss, obviously, and we've known this for years now, that, you know, being thin does not necessarily mean being healthy, and losing weight, especially really rapidly, and you're not even trying, can be a really serious warning
unexplained,
sign. Yeah, absolutely. So, Rhonda Perlowitz, I want to thank you so much for the education here today, and we look forward to speaking with you further in the future. Thank you so much.
You're welcome. Thank you.
And that's all the time we have here today for Wisconsin Doctors. We've been here at the Fort Healthcare Wound and Edema Clinic in Johnson Creek, and I've enjoyed talking with all the guests, and we look forward to being back. From all of us here at CW57 and Wisconsin Doctors, we're inviting you to live longer, live better. We'll see you next time.